I think we have a number of challenges when we deal with our patients with von Willebrand disease. And the first one starts right from diagnostics. So I think we lack a good comprehensive way of designating our patients, of finding them, of you can't get care until you can access care, and you can't access care until you know the disease, until you've identified the patient. So our diagnostic criteria are still a little bit loose. We don't have good criteria, consensus criteria. That, I think, is where it starts. You have to identify the population before you can find out what the needs are. And then we've got the problem of fragmented care. So we've approached this with other bleeding disorders, with hemophilia, for example. Almost all, or certainly all, our severe hemophilia patients are enrolled in hemophilia treatment centers. But the enrollment of von Willebrand patients is a little bit haphazard. There are a lot of people who are bearing the burden of disease and who haven't had access to treatment because they haven't been put into the right expert hands. Certainly, internists, hematologists have some knowledge of von Willebrand disease, but they're not experts. And we've got a disease that I think benefits from treatment in dedicated treatment centers. Centers exist, the expertise exists, but we have to match the patients to that expertise. Well, we're very conscious of the fact that there are inequalities in care and in the concentration of care for people with von Willebrand disease, which is the most common congenital bleeding disorder, and hemophilia, a rarer disease, but one for which care is very well organized and has been organized for now many decades. And there are a number of reasons for that. For one thing, hemophilia has been known for millennia, really, centuries and millennia, whereas von Willebrand disease is relatively new, 100-year history, more or less. And even when it was recognized, there was difficulty distinguishing it from other bleeding disorders, including hemophilia. Von Willebrand disease is generally mild, but the fact that it's mild doesn't mean it doesn't cause morbidity, and doesn't mean that it doesn't interfere with people's lives, and doesn't mean that people don't need treatment. And I think we do actually underestimate the severity of bleeding. There are many more severe von Willebrand patients who have clinically severe manifestations than we recognize. So hemophilia care has benefited from the fact that there were pioneers who organized treatment back in the 1950s and 60s. They recognized that they were dealing with a disease that was life and limb threatening, which is generally not the case for von Willebrand disease. And then, of course, there was the terrible disaster of transfusion-transmitted infections that devastated a generation of hemophilia and that raised its consciousness in the public eye. None of this has been true for von Willebrand disease. So for these reasons, we've got a large group of people who are treated, but not in as comprehensive and organized and efficient a fashion as is the case for hemophilia. So our systems, the systems exist in the treatment centers and the advocacy groups, the lay advocacy groups, the professional groups. The systems exist, but we haven't really captured all the people who can benefit from those systems. I'm very pleased that we're able to attend this symposium today on von Willebrand disease, because I think this represents one of the early attempts to try to get von Willebrand disease a little bit higher in the consciousness of at least those of us who are involved in care of patients with bleeding disorders. We haven't really approached this in as comprehensive a fashion as we have hemophilia. And I think a real strength of this symposium is that it brings together people from different disciplines. We have adult treaters, we have pediatricians, but we also have obstetrician gynecologists, we have transfusionists. So everyone who can contribute, who has interest and expertise in the field, is being brought together. If what comes out of this is a continuing dialogue among us that leads to research initiatives, that leads to advocacy efforts, that leads even to greater prominence of management of von Willebrand disease in our home treatment centers, then we will have accomplished a lot. So I think this is an early step, and I think it's an important step in the right direction. The opening session, I think, will really raise awareness of what the key unmet requirements are, unmet needs in von Willebrand disease. Everyone who attends this symposium has a pretty good medical scientific background in the disease. But even in preparing for this session, I myself was a little bit surprised by some of the information I was able to uncover about how we are really underestimating the severity and the burden of disease that von Willebrand causes. This session, I hope, will raise the consciousness of my colleagues to the same things that I'm learning.